make sure that you hit the like and the subscribe button. Okay, so today I'm going to talk about delusions and delusional disorder. A lot of times individuals with schizophrenia can be delusional, or perhaps bipolar. Sometimes they can be delusional. A lot of students get delusions and hallucinations confused. If you haven't seen my video on hallucination versus illusion, I recommend that you go watch that because I explain in detail what hallucinations are in that video. But in a short sense, hallucinations have to do with the senses. And how many senses do we have? We have 5 senses. So a hallucination is a disturbed sensory perception. We are seeing something that is not there. We are hearing something that is not there. We are smelling something that is not there. We are tasting something that is not there, or we are feeling something that is not there. Delusional disorder. So I like this little kitty cat because it's used as motivation around a lot of times on Facebook or Instagram, and it's like when you look at yourself in the mirror, think that you're a lion. But in delusional disorder, these individuals truly believe, for example, if this cat were to look at himself in the mirror and he truly believes he's a lion, then he's delusional. If he's absolutely 100% sure that he's a lion, that is a delusion. So the definition and what characterizes a delusion is that it lasts 1 month or longer. It's usually non-bizarre. What we mean by non-bizarre is that when you talk to them, you would never think that, they present completely what we say neurotypical, or I don't really like to say the word normal, but they present what you and I would think of as normal. So you're talking to these individuals. It's not after you're talking to them for 10 minutes that you realize, there's something going on, because they just told me they're in med school, they own 5 companies, they're a chef, and they have a private jet and a private island. So, but again, when they're speaking, everything they speak normally. So the definition of a delusion is a false, fixed belief. And the key word being fixed. It's deeply ingrained. You can't argue with them. So Nclex tip, you don't challenge a delusion. You're not going to sit there and you're not going to be like, you don't have a private jet. Yes, I do. No, you don't. Right? Non-therapeutic, and you're not going to get through to them. You don't challenge a delusion. Textbook world, because there's a difference sometimes between reality and textbook world. For test-taking purposes, you may voice doubt with a delusion. So for example, you can say something along the lines of, I understand that you think you're the king of Nigeria. However, that's hard to believe because they haven't had a king since whatever, since whatever year. So remember, the intervention for a delusion is voicing doubt. Now there are types of delusions. So grandiose is a type of delusion, and it's someone who believes they are all powerful and important. So for example, there's my Bitmoji, and my Bitmoji thinks that she's the queen, and she's a rapper, and she's wearing a tux, so she owns a private yacht, and she's a CEO. So for example, a delusion of grandiosity is a messenger from God that's also a CEO of 5 companies and a pilot and a chef and owns his private island. Now, persecutory or paranoid delusions are those that feel that I'm being singled out, so I'm being spied on or chased by the FBI. That's a delusion of persecution or paranoia. Different textbooks call it either paranoia or persecutory. Okay, so with delusions, there's impaired reality testing, and the person believes that the hallucinations or the delusions are real. That's why we can't really argue with them. Now with hallucinations, we can present reality, because you can tell them with hallucinations something along the lines of, I understand that you're hearing those voices, however, I don't hear them. Or those voices, I understand that those voices are frightening to you, but I don't hear them. With delusions of persecution, again, and these are the different types. Someone's coming to get me, the FBI. A referential delusion is you're driving by a billboard and you think that that billboard, it says something along the lines of, it's your day today. But you think that billboard is speaking to you directly, and it's telling you like, it's your day, I'm gonna die today, or don't go to work today, or you're watching the news and they think that the newscaster is speaking directly to them, or they just listened to a song and they think those lyrics were written specifically for them. Not that the song speaks to me, but these lyrics, this writer of this song wrote this song for me. That's a referential delusion. A grandiose delusion we talked about again already. Erotomanic delusion, break down the word. Erotomania is thinking that someone is in love with them. Brad Pitt, Angelina Jolie. Nihilistic, they don't really test on that one too much. It's more of the pessimism. Everything is wrong with the world. And think of you, I'm so sad. Everything is awful. The world's going to die tomorrow. There's a comet coming, right? Somatic is a belief, an erroneous belief that something is going on with their body. Their body's malfunctioning or it's working differently. So for example, some patients will sometimes say, my organs are grapes. Or another one said that she had little men stabbing her. Now it's important to listen to them though, because I did have one patient, she was developing appendicitis, and that her interpretation of that was, I have little men stabbing me. And then delusion of control. I had a client, for example, that he wouldn't take his insulin because he thought that by injecting his insulin, it was going to go through his blood and it was going to go to his brain, and there was a microchip in the insulin that was going to implant in his brain, and we were going to control everything he was doing. So that's a delusion of control. So a somatic, here's another example. My body is infested with parasites. I'm growing a third arm. I'm rotting from the inside. Whereas referential, they believe that a billboard or a celebrity is sending a message meant specifically for them. Nclex Practice. A client reports having thoughts of being followed by foreign agents who are after his secret papers. Which response by the nurse is most appropriate when responding to the client's disturbed thought process? So remember, when we read a question, recognize your keywords in the question stem. So keywords. A client reports having thoughts of being followed. So followed, foreign agents, secret papers, and then what response is the most appropriate? Remember, you take nursing tests and you're like, I don't really like these options, but what's the most appropriate? When responding to the clients, and here's the key word, remember, delusions are disturbed thoughts. Hallucinations is a disturbed in regards to sensations. So disturbed sensory perception is the NANDA for hallucinations. The NANDA for delusions is disturbed thought processes, right? I cannot reiterate that enough. Remember that with delusions, you have disturbed thought processes. So, I don't see any foreign agents. I think these thoughts may be frightening to you. I don't know what you mean, and I'd like you to come to group with me right now. Which one is the most appropriate? So I don't see any foreign agents. Let's start by eliminating, right? I don't see any foreign agents. What did I say? I said you don't challenge a delusion. Doesn't that sound like we're challenging them? I don't see any foreign agents. Remember, this is a delusion, not a hallucination, so we're not presenting reality. So we eliminate number 1. Number 2 sounds pretty good. Let's go to number 3. I don't know what you mean. That just sounds like we're blowing them off. That doesn't sound very appropriate. I'd like you to come to group with me right now. Is that a response to the client's disturbed thought process? No. We're not even addressing it. So the only one that's addressing his disturbed thought process are 1 and 2. And 1 is challenging, so it has to be 2. I think these thoughts may be frightening to you. That's why it's important to read the question stem carefully and to identify, what is the question asking me? So, how do we intervene with delusions? You don't challenge a delusion until reality testing improves. It's never useful to try and prove that a delusion is wrong. So, for example, the patient says, you people are all alike, all part of the FBI, and it's a plot to destroy me. An example of therapeutic communication would be, it seems to you like people want to hurt you, right? She's incorporating his delusion. His delusion is someone's out to get him. So she's using a little bit of the reflection back. It seems like people want to hurt you, and that must be very frightening, right? I will not hurt you, and we can work together to help you feel safer. So she's not saying, we're not out to destroy you. She's acknowledging the fact of his emotions and saying, I will not hurt you and we will work together to make you feel safer. So, like always, I like to end with my meme. Who says nursing is stressful? I'm 39 and I feel great. Thank you so much for tuning in. I hope this helps in regards to understanding what a delusion is. Make sure that you hit the like and subscribe button and tune in weekly for more content. Thank you. Bye.